Hello, I'm Dr. Keith Vester. Envarsus, the brand name, and Tacrolimus XR, the generic name, refers to the exact same medicine. Other nicknames include TAC, Tacro, and FK. We encourage you to be familiar with these names as they may be used interchangeably by your transplant team. This medicine prevents rejection to help protect your transplanted organ. Envarsus is a once-a-day tablet and should be taken in the morning. Taking your medicine at the same time every day can be hard, so your transplant team may give you a window of time that you can take your medicine at each scheduled time. Remember, it's important that you never miss doses of Envarsus unless specifically instructed by your transplant team. It is best to take Envarsus on an empty stomach. Your transplant team uses blood work to customize a dose that's right for you. Many patients will have blood work a couple of times a week, in the mornings, for the first few weeks after you leave the hospital. You should have your blood work drawn right before your morning dose of medicine. It's very important that on the mornings of blood work, always have your blood drawn first before you take your morning dose of Envarsus. As soon as your blood's drawn, you can take your medicine. Always bring your medicine with you on days of blood work. This will help prevent you from missing your morning dose of medicine. Your transplant team can help come up with a time schedule that works well for you before you leave the hospital. As a reminder, your dose of Envarsus may change frequently. Make sure you write down your new dose every time it changes. Do not rely on the instructions on the bottles as these quickly become outdated. Envarsus tablets cannot be cut in half and should not be crushed. Envarsus is available in many different dose strengths. Pay close attention to the strengths you have at home to make sure you're taking the correct dose. Since your body will require a specific dose of medicine, it may be necessary to use multiple tablets and different dose strengths to come up with the dose you need. Pay close attention to the directions your transplant team gives you so you're taking the correct dose. Some patients may develop tremors, often in their hands, when they first start taking Envarsus. This is usually not a sign of harm or damage to the body and usually gets better with time. Envarsus can cause high blood sugars, high blood pressure, and high cholesterol. These will be monitored by your transplant team and can be treated if any of them develops. Envarsus can also cause headaches for some patients. This usually gets better with time. Tell your transplant team if you have frequent or severe headaches.